breath in. Beautiful. Whew. What's up guys, Dr. Drew here, back on the channel. Thanks for watching this video. If you haven't already, make sure you hit that like and subscribe button below. Today I'm here with Jasmine. She's been a patient with us for a few years now. Jasmine came in originally with some headaches, some neck pain, fatigue, things like that. Currently she's in a different phase from corrective care to more maintenance on a week basis. A little bit about herself. She's not only a corporate worker working a 9 to 5, but as well she does videography and photography. So she's again editing at a desk, hunched over, as well as taking photos and videos with her clients. So I wanted to show you guys a little bit about her, kind of have her explain what's going on, why she came into the office, how she found us originally, why she still comes back, and then kind of go from there. So Jasmine, just tell the viewers a little bit about yourself and everything that we kind of discussed.
Yeah, sure. So like you mentioned, I'm at a desk a lot at my corporate job. I'm editing, I'm hunched over. So I've been trying to be more aware of that and, you know, have like a standing desk and all that, but I'm still at a desk a lot. So I actually found them, I think it was like a Facebook ad
a while back,
years ago. And then I was hooked. Everyone here is so awesome. The culture here is great. Everyone is so nice and supportive. And I live kind of far actually. So I come here because I work nearby, but like I still come here even if I live far because it's just worth it and they're a great team.
Yes. So. Yeah, so kind of what Jasmine, just to touch on a little bit about what she said. So all you guys probably watching this video have some sort of job role where you're at some sort of desk, whether it's sitting or standing. So first thing we always want to do is get you guys out of pain. And then the second thing is we want to educate you on how to stay out of pain, whether that's with ergonomic workplace environment stuff. So standing desks, how to have breaks in between your sitting throughout the day, things like that, because unfortunately with technology nowadays, it's not going away. So once we get you out of pain, we're able to be stable. We want to maintain that and kind of move forward like that. So we're going to go through Jasmine's full spine adjustment from her mid-back, lower back, neck, shoulders, elbows, and wrists. And then once we do that, we'll do a big decompression at the end. So make sure you watch to the end of the video. All right. All right, guys, first thing we're going to do is we're going to warm up some of this tissue, starting with these glute muscles. And then just working our way up through the spine here. How was your weekend? Did you guys get outside with this nice weather? Yeah, today's nice too. Perfect. Big stretch here. Hydration's been good. So if you guys are listening to this video still, I always tell patients you want to take your body weight, divide it by 2, and that's how many ounces of water you want to try to shoot for a day. The reason is your muscles are made up of 98% water. So if you're dehydrated and again you're having caffeine, coffee, things like that, it's only going to cause more spasms, more tightness throughout the back, which is not going to allow those bones to move properly, going to give you tension headaches, things like that. So we want to eliminate that by doing those things throughout the day. All right, first thing, piece is going to pop up here, just this right hip. It's going to drop. Good. We're going to adjust the mid back here. Good. Deep breath in. Good. All the way out. Good. Deep breath in. Beautiful. Good. Let's relax this right shoulder. Perfect. Good. A little bit deeper there today. All right, so we're gonna have you on your right side. Face me. We're gonna adjust the lower back and the hips here. Perfect, good, other side. Got a busy day at work?
Yeah.
Good. Whew. Good. When's the last time you got a massage?
Over a year.
Got to do it.
I know.
Treat yourself, guys, to a massage. It's going to help. Tension, stress.
I'm telling my husband we got to go for one, both of us.
Good. Turn to the right. Good. Good. To the left. Good. All right, I'm gonna be swinging your legs to the left. Come on up. All right, guys, we're gonna get Jasmine's shoulders adjusted, then her elbows and wrists. So I'm gonna reach around, we're gonna grab this elbow first. Perfect. Good. Good, go ahead, stand up for me. Full body adjustment here. Good, it's moving good. Nice, good, pull that shoulder up. Good. Do this other side. Hear that clicking in there, guys? Gotta get that joint mobile again. There we go.
This is the only use on my mouse.
Yep, you guys are using a mouse all day. Perfect, awesome. All right, guys, we're gonna do that big decompression right now, so stay tuned. All right, guys, we're gonna do a big decompression here. So we're gonna have Jasmine lift her head up. Good, relax. Best thing on this, guys, just take deep breaths. Keep that jaw clenched without tightening it. Good. Nice and easy. We're gonna do a couple pulls here. We're gonna increase in tension as we go. Already feeling that decompression, nice. Good, a couple more pulls. Whew. Stay right there. Catch your breath. How you feeling, Jasmine? That was a good adjustment. You feel it all the way down your butt?
Yeah, all the way down my feet.
Nice. Shoes almost came off. Now after this, guys, you really gotta drink water and hydrate. That was a massive decompression. We're opening up that disc space, opening up those nerve root holes, allowing that tissue to heal, getting more fluid throughout the body with that sense. So again, if you haven't seen these videos, make sure you hit that like and subscribe button. Truly appreciate it, Jasmine, for being patient with us today. And we'll see you guys in the next video.
Yeah.